Have you ever noticed some boys developing what looks like small breasts during their teenage years? This can be a bit surprising, and maybe even a little worrying for them and their families. It's a condition known as gynecomastia, and it's actually much more common than you might think. It's not something to be ashamed of, and it usually has a perfectly natural explanation, especially during puberty. So, what exactly is gynecomastia? Put simply, it's the enlargement of breast gland tissue in boys and men. This isn't just extra fat. It's the actual growth of the same type of tissue that forms breasts in girls. This happens because of a change in the balance of two important hormones in the body, estrogen and testosterone. You might think of estrogen as a female hormone and testosterone as a male hormone, but everyone's body produces both. During puberty, a boy's body goes through a huge number of hormonal shifts. It's a time of rapid growth and change, and sometimes the hormone levels can get a little mixed up temporarily. If a boy's testosterone levels dip slightly, or his estrogen levels rise a bit, this imbalance can cause breast tissue to grow. It's a very common part of the pubertal process for many boys. Scientific studies show that pubertal gynecomastia affects a large number of teenage boys. Some research suggests that up to 65% of boys between the ages of the 10th and the 16th of may experience some degree of breast enlargement. That's a huge number. It means that more than half of all boys might go through this. So, if you or someone you know is experiencing this, you are definitely not alone. It can affect one breast or both, and sometimes it can feel a little tender or sore to the touch. The amount of growth can vary a lot, from a small, barely noticeable button-like lump under the nipple to more noticeable enlargement. One surprising fact is that this hormonal imbalance isn't just limited to puberty. Newborn baby boys can also have temporary gynecomastia. This is caused by the estrogen they get from their mother while in the womb. This newborn gynecomastia usually disappears on its own within a few weeks after birth as the hormone levels stabilize. This just goes to show how sensitive the body is to hormonal changes at different life stages. So, how long does it last in teenagers? For the vast majority of boys, pubertal gynecomastia is a temporary phase. It's a normal bump in the road of development. As puberty progresses and hormone levels find their new, stable adult balance, the condition usually resolves on its own without any treatment. This process can take anywhere from a few months to a couple of years. Patience is key here. It's important to understand that the body is just figuring things out. Panicking or feeling overly anxious about it can make the emotional side of things much harder. Of course, it's completely understandable to feel self-conscious about it. Teenagers are already dealing with so many changes to their bodies and social pressures. Feeling different can be tough. It might affect choices in clothing, like avoiding tight shirts, or activities like swimming. Talking about these feelings with a trusted parent, guardian, or doctor is a really good idea. A doctor can confirm that it's pubertal gynecomastia and rule out any other less common causes. This can provide a lot of peace of mind. They can assure you that it's a normal part of growing up for many. It's important to distinguish gynecomastia from something called pseudogynocomastia. While the names sound similar, they are different. Pseudogynocomastia is simply an accumulation of fat in the chest area and isn't related to the growth of breast gland tissue. A doctor can easily tell the difference. True gynecomastia often feels like a firm or rubbery disc of tissue located directly beneath the nipple area, which is different from the softer feel of fat. So to recap, gynecomastia in puberty is a very common condition caused by temporary hormonal imbalances. It affects a large number of boys and almost always goes away on its own. Understanding the why behind it can make it much less scary. It's not a sign that something is wrong. It's just a sign that the body is going through the complex and amazing process of becoming an adult. If you have any concerns, always speak to a healthcare professional. They can provide reassurance and the right information for your specific situation. We hope this helps clear up the truth about male breast growth during puberty. Remember, our bodies are all unique and go through different journeys. For more clear and straightforward information on similar topics, be sure to check out more of our content here at Sex Education Repo.